Hello, I'm Neil Francis. Opponents of assisted dying law reform will often tell you that more palliative care is always the answer when a terminally ill patient makes a persistent request for assisted dying. But clear and readily available evidence contradicts that view. Australian palliative care pioneer and recognised expert Dr. Roger Hunt explains not only his own clinical experience, but also that
all the research that I've seen from even the most prestigious palliative care units shows that dying patients have multiple concurrent symptoms and sources of suffering in many dimensions.
Here are just a few examples of published expert experience of intolerable suffering at the end of life from around the world. From current oncology reports. Some patients approaching death have refractory symptoms. From the Journal of Pain and Symptom Management. Patients near the end of life may experience intolerable suffering refractory to palliative treatment. From the Journal of Clinical Oncology. Despite the progress made in palliative medicine in terms of symptom control, there are still many patients who have intractable symptoms. From the Indian Journal of Palliative Care. Patients with advanced cancer often suffer from multiple refractory symptoms in the terminal phase of their life. And from the British Medical Journal, palliative care cannot remove every kind of distress. It's no surprise then that the American Academy of Hospice and Palliative Medicine, which is neutral to assisted dying law reform, says, palliative care can relieve most suffering near the end of life. On occasion, however, severe suffering persists. Here in Australia, Dr. Odette Sproit, as President of the Australian and New Zealand Society for Palliative Medicine, said, "It is simplistic to argue that palliative care can remove all suffering at the end of life." And Australian peak body Palliative Care Australia, which is also neutral to assisted dying law reform, says in a policy statement, while pain and other symptoms can be helped, complete relief of suffering is not always possible even with optimal palliative care. So what happens when palliative care can't always help? The Honourable Ken Smith, Speaker of the Victorian Parliament, and I visited the USA state of Oregon to research their Death with Dignity law. Dr. Hugo Richardson, a board-certified palliative care specialist at the Oregon Health and Sciences University, shared his experience both before and after their law reform.
We saw many patients who felt that they had reached the end of traditional treatment for their disease and that there were no options. We saw, at least in the experience within the health maintenance group where I was working, we saw many more violent suicides among terminally ill patients. The year before we began working on this law, this was long before it was passed, we had 4 violent suicides in our hospice patients. People who just simply felt that they had run out of options, that even though they were being provided adequate palliative care, that life had become intolerable for them. And since that time, I have seen, in that same population of people, I've seen no violent suicides.
But is there a shortfall in palliative care practice in Australia that might lead to suboptimal care? Well, the answer is no. In global research conducted by the Economist's Intelligence Unit, the quality of palliative care services in Australia is a very close second to the United Kingdom, the recognised gold standard around the world. Practice standards here are a great credit to the dedicated men and women who work selflessly in the service of dying patients. Yet as we've seen, palliative care still can't always help. Perhaps this is why Dr. Scott Blackwell, then President of Palliative Care Australia, said, "In some ways, I think let's legislate it and let it just find its place." We can celebrate that the quality of palliative care here in Australia is extremely high, yet acknowledge at the same time that even the best palliative care simply can't remove some intolerable suffering experienced at the end of life. So I commend the Ending Life with Dignity bill to you and urge you to give it your support. If you have any private queries, I'd be happy to answer them in confidence. Just direct your questions to me via the South Australian Voluntary Euthanasia Society. Thanks for watching.